It's time for the Science Cafe!
Learn about the latest technologic innovations today.
And you don't have to pay.
Expert panels with advanced degrees are sure to satisfy your curiosity.
Since we mention it's free.
And if you think you'll find a better time than this, then come on down and test your hypothesis. Cause you're gonna learn a lot if you wanna stay down at the Science Cafe.
So my name is Dan Marchek. I'm one of the organizers of Science Cafe, and we're here tonight to talk about concussions. The way this works is it's pretty much a question and answer, so I'm going to give the panel a chance to introduce themselves, and then you'll have a chance to ask them questions. So tonight is CTE and Concussions, and we're happy to have Liza Blondeau, who is... You work with the city, you work with Harbor Homes, right? She's a supervisor of psychiatric registered nurses. Is that right? And we have, to your right, Dr. Chris Lonagan, and he is from Access Sports Medicine, and he is a sports medicine specialist. Yep. Is that right? Yep. All right. This is all hearsay, so.
So far it's true.
And to your left, we have Jock Patterson, who founded and runs the National Sportsmanship Alliance, and he was also a coach in probably a past life or currently?
Until about 6 years ago.
Oh, yeah? All right, so I'm going to give them a chance to introduce themselves in a little more depth, and then we will ask them some questions.
My name is Liza, and I am a psychiatric nurse, and I do work with people with traumatic brain injury, major mental illness, developmental disability. But I am primarily here tonight as a parent of a child who received a traumatic brain injury from a football accident when he was 10 years old. And I do believe it changed the trajectory of his life, and he is 19 years old now, and he still has lingering effects of that injury, including personality changes. There's some frontal lobe damage, so there's a lot of lack of inhibition and insight, some impulsivity that he has challenges with. He has some processing issues. He can think as quickly as the next person, but for him to write something out on paper or type it in sort of a non-frustrating manner, it's a big challenge for him. It has impacted his ability to keep up in school. He missed a lot of school when he first got the injury. He had to stay home a month. He was down in Children's Hospital. He had lost consciousness, and he had neural deficits down half his body. So they said that he couldn't go to school for 2 weeks after his last symptom. And so we were at the month mark, and we thought he could go back to school, but then he got vertigo at the top of the stairs and almost fell down the stairs. We dealt with night terrors. We dealt with wetting the bed, and this is a 10-year-old kid that was a long past. He was a really shy, introverted child, and then he was just sort of super outgoing, what people would refer to as ADHD. Migraines, terrible, terrible migraines still to this day, where I come home from work and he's laying on the bathroom floor and he's been throwing up all afternoon. He's never been diagnosed with narcolepsy, but I suspect there's a touch of that as well. So it did make a dramatic impact. He is 19 years old. He's in his 5th year of high school, and he's only about 14 credits because he can only tolerate about 2 classes at a time. So, in the way the school system works, there's a lot of resources for developmental disability and learning disability, but it's a sort of a unknown territory with the medical. We don't have the same access to a lot of the services to kind of get him through. So we've been doing a lot of it on our own.
I'll start you with the National Sportsmanship Alliance, which I began in the spring of 2014 because I saw a lack of sportsmanship in high school sports here in New Hampshire. And I'm from Massachusetts, and there's a lack of sportsmanship there also. It's not that I was picking on New Hampshire. But once I became involved, I found out about the concussion issue more than I had known when I was coaching. We were preventing concussions. We were doing all of the normal of the things that you're supposed to do now to prevent concussions in games. And I was coaching football. And that was, they say, face up, see what you hit, and so forth. And we were doing that. But then I found out so much about those that are never taken seriously. And that is because I won't use a name, but player number one has a headache, but he doesn't want to tell the coach or the trainer because he doesn't want to miss the next game. And in that regard, player number one then has a second incident. And now someone has to know about it, and the doctor takes a look at him and asks him questions, and he relates that it had happened before. Now, the reason for my becoming so involved with this National Sportsmanship Alliance is because I found that there are so many of these. This isn't like a 10% thing. This is like a 50% thing with high school kids. And if any of you have high school kids who played and who have played football or even soccer, there are so many concussions that occur in soccer because they head the ball. I've talked to, I'm going to use numbers here, it's awful. I've talked to hundreds of high school football coaches. Hundreds. And they all say the same thing. We get about half of them. About half of the traumatic brain injuries are reported to a trainer. I think it's more now. I think there are more people now that are being more open about it. But I will give you that. The people who were saying about half, that's probably as many as 8 or 10 years ago. Since then, things have become much more open. But nevertheless, we have some people who are hiding them. And one of the statistics that they use, I go by the National Federation of State High School Associations. They write the rules for everything. They say that there are 4 million traumatic brain injuries in high school sports each year. 4 million. But there are millions of kids playing all over the country. That's not 4 million in Massachusetts or New Hampshire. That's 4 million across the country. They also say that 47% of those traumatic brain injuries occur in football. Practice games. Only about 10% of the football injuries occur in practice. But 47% of that 4 million comes out 1,880,000 traumatic brain injuries in high school football. That's not youth and high school, that's just high school football. 1,000,088. Now, when you get rid of 10% of that, that's still 1,000,000.7 that are occurring in games. That's a tremendous number. And yet when I talk to principals and I say, let's deal with this concussion issue and let's see if we can do something about it, well, there are people in Indianapolis that take care of that. So that's where I am. I'm trying to get into schools, colleges. Colleges take care of themselves. And colleges are doing a much better job than high schools are. If you watch college football on television, which I do every weekend, you'll see that boys are being ejected from the game for a head-to-head hit, which no one caused. It just happened to happen. And yet, the defensive person being the aggressor has been eliminated from the game, has been ejected from that game at that time. Now, people say it's unfair, but I'll tell you what they're doing is they're setting a precedent. You will now watch the game from the bench. And I want to be able to do that in football. And what people say to me then is, you're killing the game. And I said, wait a minute. I'm trying to save the game. My whole reason for being is to save football and let high school football continue. The people who want to stop it in the elementary grades, I have no argument with them at all. If that's what you want to do to better the sport or to save the kids, that's the big thing.
My name's Chris Lonegan. I currently work at Access Sports Medicine and Orthopedics, which is the offices I work in are Plastow and Raymond. I'm new to New Hampshire, very excited to be here. And I guess I'll start off with my sort of trajectory to getting where I am. So I actually started off with a primary care residency, so 3 years of family medicine training. Due to an interest in sports, I ended up doing a fellowship in sports medicine, which I actually just recently completed at the University of Connecticut. So that's where, so my experience with concussions and treating them is not for as long a duration as these two, but was really sort of concentrated in the last year, basically with sport-related concussions, specifically with the university and kind of what it takes to kind of get the athlete back on the field and also deal with any other complications that may arise. A big portion of what we end up doing, we do everything non-operative, and then we also, concussions are becoming a much larger part of what we do, and sort of coming up with ways, kind of thinking outside the box to really deal with the patients that are having prolonged symptoms and difficulty returning to their sport, what they like to do.
So the doctor said that he deals mostly with concussions, and so what do you do about them? Like, what is it that you do?
A lot of what we do is pretty structured and pretty organized, kind of what is done at high schools. We work very closely with athletic trainers who follow patients on a day-to-day basis, filling out these symptom scores, which basically is probably 15 or 20 different symptoms that are pretty common in concussions, and rating those on a scale. So we interact a lot with the athletic trainers in terms of following those numbers and progression of those getting better. In terms of treatment, originally with concussions, the thought was, and not even too long ago, was, oh, someone's had a concussion, they have to stay up all night, get no rest, and because there was concern of like a severe traumatic brain injury, I suppose. So now one of the things that we do is making sure that people can get the cognitive rest that they need. So making accommodations at school for those people, limiting time in school, limiting the surroundings that cause them more symptoms, bright lights, blue lights, kind of just discussing all of those items with the family. Other things, fish oil is something I normally recommend to people who have a brain injury. And then something that I found very, very helpful. A lot of people I've noticed will have some oculomotor issues, so nystagmus or difficulty following trajectories with their eyes, which I think like there's can be anyways, and there's all different types of concussions, but a disconnect between what your eyes are seeing and how they're moving versus what your vestibular system or your inner ear is sensing in terms of balance. So oculomotor therapy is something I'm prescribing a lot of right now, which I have found to be very, very helpful.
What is ocular motor therapy?
So basically, it's a lot of concentrated eye techniques that basically, it's like physical therapy for your eyes and your eye motion. You have a number of different exercises that patients can do. So some of the testing that we do, it's called saccades, is we basically hold our fingers like this and this and this and this, and have the patient kind of rapidly move their eyes up and down between the two and across and see if that causes symptoms or if the eyes can smoothly follow that. So less intense versions of that is pretty helpful, and keeping all of that training below symptom threshold. One of the major things right now is, or probably always with concussions, or since they've been starting to be adequately treated, is not going beyond the development of symptoms. So also another thing I forgot to mention is we are also trying to get people back to like cardio type exercises earlier than we originally thought. We used to basically keep people until they were completely asymptomatic or down to their baseline amount of symptoms before returning them to exercise. But now we're finding that increased blood flow, in fact, can be helpful for, getting blood flow to the brain to help help the neurons that aren't really firing and working well to get replenished with nutrients, so on and so forth. So,
Liza, your story is so heartbreaking. And I guess one of the things that I've seen more recently is, okay, we'll just keep all those kids out of contact football until they go to college. To what degree have you seen this, what happened to your son, in more instances? Is there a broader story that we should be aware of, that we'll just wait until they get into college before they do this? What can you tell us about beyond, again, I am so sorry for your story, it's just, but what can you tell us more broadly about this?
What's really hard too is after all of that, my son actually wanted to return to football because it is so much it was his social group, it's his support peer, so that was his whole life. It wasn't even just the sport, it was everything to him, because when a child plays a sport like football, they start in August and they're 5-6 days a week, all the way up until November, and then a lot of those same kids play other seasons of sports together. So he was really, really upset. So we didn't want to say no. My husband played football his whole life. We're football fans. I was on the board and I actually remained on the board after he couldn't play anymore. So maybe it is waiting until later for tackle so they can learn the game and learn plays and get some sort of cognitive intelligence behind the game before they start hitting. The hit that hurt him actually was an illegal hit anyway. It wasn't allowed. It is true that often they are during games, but being smarter about practice, our organization had every coach get training on concussion prevention and identification. And so I can identify a concussion almost on sight. So I was pulling kids off the field that I thought were questionable. And so it is changing the culture a little bit. But my daughter played sports that were with high concussion rates too. So you can't wrap your kids in bubble wrap. It is tough to decide, what's best. But he did remain on the football team for a little while longer. He was sort of a special teams kid, so he kind of just warmed the bench, but at least he got to be part of the culture for a little while longer. And his friends have all graduated high school and gone to college, and he's still home and taking classes because, like I said, he can only tolerate about 2 classes at a time. So, but they're still his friends. So after all of that, those are the people that had his back.
First, why fish oil? And 2, if you see someone today, can you tell that they've had a concussion in the past?
in terms of fish oil, just the omega-3 fatty acids help. So a lot of the sheath, so neurons are, in terms of what they do in order to sort of speed up the way that they transmit, is they're covered in these sheaths, which have a lot of fat in them. And so it's just providing that extra or more of that nutrient in a time of need in terms of regeneration of that. Even when you're treating a known concussion, there's a lot of confounding factors involved. So a lot of people may have migraines at baseline or have problems with their eyes at baseline. And that is difficult to tease out when you're treating a concussion. Is that related to the concussion, or is that something that's always been there? And so I wouldn't say that I could just tell that someone had a concussion, because there could be, an underlying psychiatric disorder that they have that Yeah, I don't think I can. I'm not capable of that.
From the very beginning, from 5 years ago or 6 years ago, I came in contact with Dr. Eric Schwartz at UNH, and he was in charge of studying concussions in the different sports. And at the time, Dr. Schwartz, a wonderful guy, told me that we can't differentiate. Right now, it's all traumatic brain injuries, and we will decide case by case whether this person should sit out a week and we'll re-examine, or a week or two from then, and then we'll re-examine. And there was no hard and fast rules and no hard and fast categories. And now I've talked to him just a couple of months ago. He is now at UMass Lowell, and when I said to him, Dr. Schwartz, do you recall saying to me, there are no categories? He said, absolutely. I said, then what about this group that is categorizing mild, moderate, severe TBI? He said, I don't like to hear that because someone may say that something is moderate, someone else might say that it's severe. Absolutely. So let's not have any categorized, but if they want to say that, some group wants to say that, then you can't prevent it. But again, I don't want to categorize, but I do know that, for instance, from the very beginning, if a kid had a little bump on the head, you might say they had a mild concussion, and then if they lost consciousness for a minute, half a minute or whatever, you'd say that it was severe. There were those two. You lost consciousness, severe. You didn't lose consciousness, it was a bump on the head. And we don't do that anymore. We examine and re-examine to the point where, and that's what some people say is, too much examination. I'll give you this one. An athletic director that I've known for 40 years, south of the border, said, when a kid gets a concussion, he should be out for 5 days. 5 days is it. 6th day, he can come back in and play. I said, what about the re-examination? There's too much of that. I said, you're astounding me with what you're saying. He said, well, yeah, but that's the way everyone should feel. And if everyone felt like that, we wouldn't have so many concussions. Wow. Wow, I was staggered. I want to give you 2 words. The word protocol. Can you tell me what protocol means? Can anyone tell me what protocol is? It's a list. Protocol is a list. Oh, I'm not picking on Dr. Lonagan, believe me. I respect these people tremendously. But protocol is a list, and it's a list of what you have to look for. And when you're examining someone or one of those certified trainers who do a wonderful job, when the certified trainers are examining a kid who just came out of a game, they're asking that boy questions, or that girl playing soccer. They're asking her questions. And how you answer the question determines to them whether you should be out for a while, re-examined, and most of them will say, see your doctor. That's the smart thing. So we know what protocol is. It's a list. My word for all of these things is prevention. Prevent it before it happens. We say quicker whistles prevent concussions. Because in the game of football, there are sometimes when the whistle is delayed quite a while there's a smack and a hit and a push and another smack, and somebody's getting hit, and usually it's the defensive person who's trying to push the pile back, that's using his head to push the pile back, and he's hurting himself. So we're saying quicker whistles would prevent that. And yet the football people say, yeah, but a quicker whistles will ruin the game. My God, it ruined the game. I said, what about the brain that's being ruined? So those are my 2 things. I believe we need to have the protocol. There's an organization down in Boston that's having a big dinner next Thursday, I think. And their whole thing is not prevention, but what we do once the child or the adult or whatever has been to the doctor and been told they have a concussion. And they want to work with that. And when I say to them, but if we could get together and do some prevention, well, They don't want to get together and do prevention because prevention will put them out of business. And I mean that very seriously. They won't even talk to me about prevention. So I just want to tell you that that's what I'm concerned about mostly is stopping the action. Blow the whistle, stop the action, because once the action stops, nothing else can happen.
So thanks, Jock. Before we go to the next question, I just wanted to put that back on the doctor and say, you raised the issue before of multiple kinds of concussions or different kinds of concussions. So what are the protocols? What are the kinds of concussions? What are we talking about?
I'll start off with the protocol. So the protocol, for, at least from my end, is, if you're, say I'm covering a football game and there's concern of a concussion, you first go to the sideline examination where you take the patient through a form that we have, which is called a SCAT, Sport-Related Concussion Assessment Tool, which is a number of cognitive tests as well as symptoms as well as balance. And you kind of take that all into account as to whether you're concerned for this person having a concussion. That being said, in the very acute phase, like sideline coverage, you don't necessarily have to go through all that because either A, it'll be making their symptoms much worse, or B, you can pretty much tell right away when you're talking to someone, or sometimes anyways, whether they have a concussion. So then protocol proceeding from there is the athletes follow up with their athletic trainer every single day, like I was talking about earlier, and fill out these forms which have all of their symptoms on it as well as the severity of those. And we, again, follow that on a day-to-day basis to make sure that they're showing progress towards improving. And then if they're not, then we sort of look at those lists and say, hey, what on these lists is the most pressing issue? So like I was talking about, someone with dizziness or balance issues, they might be more of someone that's kind of like a subset of concussion where I would think about the oculomotor retraining. Then there's people with like light sensitivity, so more of like a migraine type issue associated with their concussion. So there's medications that sometimes can be used for that. And then there's also people who have more of like issues like psychiatric issues associated with their concussion or unmasking some things that, maybe they had a degree of anxiety and it's just blown out of proportion. So temporarily treating that anxiety is something you can do. So I kind of answered a little bit of both questions, but now back to the protocol. So in addition to all of that, a lot of the athletes, and I'm pretty sure this happens in New Hampshire too, but there's there's cognitive testing that can be done with Impact. So it's an online testing that can be done, and you're supposed to do that before the season to get a baseline of your cognitive function, and then once their symptoms are improving and you're thinking about maybe returning them to full play, you repeat the test and see how that's going. So that's a part of our protocol too. We also have a bunch of different tests, balance testing that we do. I do every time in my office. It's not something I think that the trainers necessarily do every time. So those are kind of the things that we do, and just working very closely with the athletic trainers is incredibly helpful because they get to see the patients every single day. I get to see them for 30 minutes in an office visit, maybe once or twice, or longer if it's if their symptoms are lasting longer.
Well, I want to start with, I've had a severe traumatic brain injury, and I come from a family that my wife and my kids are much bigger sports fans than I ever was or am now. But football is a big part of that as far as an enjoyment thing, not a participation thing, thankfully. So first, for Liza, I know what you have gone through with your son and shepherding him through this new phase of his life. And it's hard to say that and not get emotional about it, but
Yeah. Thank you.
yeah. But two, for Jock, because I know how my family is so enthusiastic about football, Jock, to me, you seem fairly heroic in that you're finding ways to turn your love of the game and how it can change so that we can continue playing the game and not really destroying our youth and then our young men. And before I ask Chris the question, a simple question, is who was not relieved as all get out that Rob Gronkowski retired? I was like, oh, thank God he retired. Because, you know, hooray for him, but he's taken too many hits, and every off-angle hit I saw him take, it was just sick in my stomach. So for Chris, as you see with presumably mostly younger people, how many successive, sorry, I should preface this. So I had a severe TBI. I had an accident, and it resulted similar to, it sounds like Liza's son's incident, right? Which is not so much cumulative, but acute in its occurrence. But CTE tends to be a cumulative bang on bang on bang on bang, and you just kind of rupture the gelatin of the brain. So it's this progression that happens. So my question to you is, what do you see in students and young people, presumably mostly young people, I don't know, perhaps college students? What do you see in that? Do you see continuous returns with similar incidences of concussion? So like if you see a patient, for example, the third time with a similar thing, do you kind of get that feeling in your stomach like,
Do I worry about?
yeah, do you worry about
Yeah,
hey, maybe it's time to sit, you know?
Yeah, I mean, so I definitely worry about that. That's something I worry about and think about. But there isn't any, there's no definitive number of concussions or subconcussive, so a hit to the head that doesn't cause you these prolonged symptoms. There's no specific number that's been found in the research that says, okay, you're on a trajectory for CTE. So it's really hard to balance this this real desire of a child or even an adult to do the sport, the athletics they love to do, that keeps them active, keeps them otherwise healthy for their other organs. So it's really hard to balance those two. So I don't have a number where I have a cold cutoff and I'm like, you need to stop. It's just always something that's sort of discussed, risk benefit. So like I said, there's no definitive number, but some of the research is showing that if you have 3 or more concussions, you are at about 3 somewhere. Your chances of getting CTE is about 3 times that of someone else. So the other risk factors are age of first impact or first serious head injury, being less than 12 years old. So that kind of goes into some of the stuff that Jock was talking about learning to play the game, but not necessarily doing the helmet to helmet type stuff for football. Well, I guess you should never do that, but so having a discussion at a young age, is this something that's beneficial to be tackling at that age? I don't know. I just know that is a risk factor for getting CTE. That being said, there are people who have way more hits than that, way more concussions than that never suffered any of the symptoms of CTE. I was reading an NFL player who has a full NFL career, between practices, college, the NFL, so on and so forth, will have about 75,000 what we call subconcussive hits to their head. And yet the majority of them don't suffer from CTE symptoms at any point in their life. So it's all this balance of just letting people know what the risks are, but I don't have a definitive cutoff. It's kind of just discussing with the patient and their families and about the risks and benefits.
Sorry, just a quick follow-up, and more of a kind of a hard science kind of thing, not a hard science, but more of a factual thing, I should say, is there a fundamental difference, and I don't expect you to know the full comprehensive, Wikipedia of every structure of the brain, but the difference in a 14-year-old and a 25-year-old college football player. Is there a fundamental difference in those ages in the structure of how the brain is supported in the head?
I don't think it's so much. I don't think it's so much the way that the brain is supported. I think the major issue with the younger patient is that their brain is still rapidly developing. So, if you're doing damage at a young age, are there then maybe a little small vessel issue in your brain when you're growing is a much bigger deal than when you're older, because that was blood supply to a growing area, whereas an adult you already have your full mass of brain cells, so on and so forth, if that makes sense.
I was reading today about the development of the brain and how a 14-year-old's brain certainly isn't fully developed and might not be developed until he is, say, 20 or 22. Others might develop fully by the time they're 18, 19. It's one of those variables that you can't put your finger on. And so what we need to say is that we should be stopping any of this contact action, let's say, until they are possibly out of college. And then if the pros want to do it, let them do what they want to do. But as far as the kids going through high school and going into college, and somebody saying, well, their brain is fully developed. You don't know. And you can't tell until you open it up, take a look at it, and say, oh, no, that one's not developed. Put them back, put them out. In other words, there are so many variables that we cannot put a finger on.
Earlier, there was a talk about prevention, and it sparked that I knew a friend of mine, her son, I'm back here, the first year of him playing football, he got a concussion, first or second game. He was in high school. And he went back. It took a couple of weeks, had to go through all the protocols and all the lists. But one of the things he had to go back with was a special helmet with extra padding in it, which to me, I was really surprised that why didn't he have that to start with?
Right.
So is it a cost thing?
That?
So between Jock and Liza and Chris, to talk about each part of that, is it a cost thing from the schools and parents just can't afford it? Is it better from a medical perspective that you would see less concussions if all the players had these padded helmets, special padded helmets?
My
I just wanted
son's
to bring that up.
injury led the program to invest $35,000 in the state-of-the-art kind of college-level helmets. And it does, I think there's a balance where they want the youth sports to be accessible to everyone. And if you start getting into these really state-of-the-art helmets, they're extremely expensive. And if the program owns them, they have to be sent away each year and refurbished and recertified and things like that. And so, yes, we want the best for our children, but I think at times they also are trying to think of accessibility as well. I don't know if you could speak to that too as a coach, or.
Okay. Helmets now can range anywhere from $200 for the mediocre helmets to $450, $500 for the best helmet made. And when a child, I won't say a boy because there are some girls playing football, when a child wears the best helmet made and they go in for a tackle, and instead of having their head to the side of the body, the person with the ball moved so their head hit straight on. And with the best helmet made, that brain contacts that skull. And there's nothing you can do about it. So that's why we teach, see what you hit. And if you're looking up like this as you're making a tackle, you will keep your head to the side and you'll make a shoulder tackle, which, when I first started playing football, if you made a shoulder tackle, it's because you're a pansy and you didn't want to hit with your head. That's how much the game has changed. But yet I will tell you this, since 2003, when I first started coaching with a man named Tim Walsh from Greater Old Oak, and who now lives in Pelham, and he's a very good football coach, he had us doing see what you hit. And because of that, we were having fewer experiences of concussions. Now, They're still teaching that, and yet there are people who will put their head down and hit with the top of their head, even though they've been taught not to do that. But that is the way some people react to teaching. For those of you who are teachers, you'll know. I guess what I'm trying to get at is things have changed, but they really haven't changed completely. And the whole idea of the expensive helmets, I think it's wonderful. Every kid should wear the best helmet made. They are very expensive, and yet in certain situations, it doesn't matter what you have. You'd have to be, as you mentioned earlier, you'd have to be in bubble wrap in order to play like that. What I really hope they get to is rugby. Because in rugby, they don't wear helmets, and they have very, very few. See, there's that emotion coming up again. They have very, very few concussions in rugby. So I would say let's learn a little bit from rugby. Thank you.
Additionally, I didn't know before my son's accident, too, the importance of the mouth guards. We always think of the mouth guards as a teeth protector, and they actually protect against concussion as well. So a properly fitting mouth guard is really important. A lot of the kids cut off the backs or chew them down, and so then my daughter would go through multiple mouth guards a season, and so then I was thinking I'm getting the cheap ones. I'm not going to buy a nice one if she's just going to chew it down to nothing. But there is science behind using a proper mouth guard to protect against concussion as well.
I will admit I don't know necessarily as much as I should know about the specifics of different helmets and what they can do for prevention, but I do agree that they're probably not the best answer for prevention. So I think some of the better answers for prevention are, like Jock was talking about, the way you tackle. So getting that education at a young age. Another thing that could be done is preventing the head injuries in those younger than 12 years old. As I said, that is a risk factor for developing CTE. Another would be there are some promising studies that are being done where some universities have focused a lot on actually neck strengthening, which helps sort of preventing or controlling the whiplash that might happen. And those are showing some promising results. And another big one, I think, is limiting the amount of, limiting exposure to those head injuries, meaning, and I'm not sure what the rules are in high school, if there are even rules about this. I will certainly figure that out this weekend because I'll ask. But do you need to tackle in every practice?
The organizations, the youth organizations, are additionally focusing more on conditioning before you're even allowed to put pads on. So I do know that there's coaches that would try to finagle that a little bit. But if you have a good organization and you kind of hold everybody accountable for those actions, that the kids are supposed to do X amount of hours of conditioning before they even put pads on, they don't need to tackle for most of their practices. They can practice drills and they can practice formation and everything ahead of time without having to hit. So, again, it's the culture. As long as we keep on holding these organizations accountable and training the coaches and teaching the parents. If the coaches kind of want to go rogue, but all the parents are educated, they're not going to let the coaches put their kids in harm's way. So I think that we can go at it in multiple ways.
One of the things that we hear now, and I love this, is reduce the risk. If you reduce the risk, you have less head-to-head hits. You can teach tackling without any helmets on if you're just teaching it at half speed and making sure they put their head in the proper position. You don't need a helmet. You don't need a uniform. You're teaching so that when they put on the uniform and they put on the helmet, they're using the same technique. And that limits the TBIs and everything else. But that's just something that you can do at the youth level, at the high school level. I know this. I know that colleges are no longer hitting like they used to, but they only used to hit 2 days a week at the most. High schools hit 4 days a week, some of them. And when you're hitting 4 days a week and you're playing the 5th day and you have the 6th day and the 7th day you're watching the films, high schools were hitting every chance they had. And the whole idea was you won't have tough kids if you don't hit in practice. No, but the trouble is you're going to have injured kids that can't come back to practice.
We're focused a lot on football, but this happens a lot to women too. And sometimes the head injuries, like a single head injury or a single concussion for a young woman, can be, very debilitating. Like, it takes much longer sometimes for women to recover from concussions. At least this was like an article I was reading in like Sports Illustrated or ESPN that was, talking about the effects of concussions on women, and that the effects can be, like, from a single concussion being longer term. So I guess from Chris, I was kind of wondering, have you seen this in your own practice? Do you see many women who come in with concussions, and then do you see that their symptoms are worse, or do they last longer, and do you treat them differently? And then for Liza and Jock, maybe could you speak a little bit to, like, what's being done to monitor women when they're playing these sports that we don't think of as, like, necessarily a direct injury? It's hitting a soccer ball or something like that.
So we do think of it. My daughter's a D1 lacrosse player, so I am very worried about that. And so lacrosse has women's lacrosse has a very high rate of concussion, and she's been pretty lucky and hasn't gotten a concussion. But when I was involved with the football organization, the cheerleaders, I saw some pretty nasty concussions with the cheerleaders. They do all the stunting and the tumbling, and they've got what they call the bases on the bottom, and the girls land on them and they get an elbow to the head or a knee to the head. So soccer. So it really isn't just male or female sports. We do talk about football because it's such an obvious issue, because I think it's more of a culture problem than some of the other sports. But with like female lacrosse, they don't want to put in helmets because there are girls that want to wear helmets, but there's almost a peer pressure not to, and the league won't do anything about it. They want the girls to look like cheerleaders with sticks. It's the uniforms, the little dresses. I mean, my daughter identified that right away.
One of the factors in the concussion situation is remaining hydrated. They want, especially the football players, and again, I'll say almost half the concussions in high school sports happen in football. And they want the kids to remain hydrated. That's supposed to keep the hydration level is up, and so there's less chance that the brain will collide with the skull. When they asked about, why are girls complaining about so many, about more concussions than we really thought they would have, well, the explanation was, and I don't want to say this, was, it might have something to do with the hydration. The boys want to stay hydrated, and for some reason, the girls will just take a little sip and go back out in the field. You didn't hear it here. But that's one of those explanations that wasn't an explanation. And that was a woman coach that told me that.
But when I go about treating people, I don't have like a gender, any different way I go about it in terms of gender. And maybe there is something out there that I could learn about that would be helpful in terms of that. But I pretty much go about them all the same way, which is that protocol I talked about, and sort of finding what their main issue is within the concussion and kind of focusing in on that. I probably could serve to get some more knowledge on that if there's more research coming out about that. But my answer is I don't have a gender-specific way at this point.
My sister also plays lacrosse, and in her time playing lacrosse, she has only gotten one concussion, but she knows she has people on her team who have gotten multiple concussions, and now they're required to wear a helmet. Like just that girl, just the girl who got a bunch of concussions, she has to wear a helmet, but nobody else, which I think is crazy. But anyways.
and I don't know if you've seen the helmet, there are girls who would rather wear the boys' helmet than the helmet that the girls are supposed to wear. The helmet that the girls are supposed to wear is very strange looking, and so they feel self-conscious in it. So that's another problem, that they would actually prefer to wear the men's helmet, and the leagues are saying no, that's not appropriate.
The other thing I wanted to say was, why do you think parents and coaches, a lot of them don't take concussions as seriously as like people who have been affected by concussions? If you know what I mean, like parents and coaches telling the kids to be slow so their baseline levels are low. Why do you think they're doing that?
I think some of it is education, and I think a lot of the families are generations of playing sport. I did work with parents when I was on the board that were just so competitive that they absolutely were not considering their child's best interest at all, and that's too bad too. But I do think everyone gets sucked up in the competition sometimes, and they just kind of lose sight of the big picture.
I know you talked a little bit about like different risk factors that might increase the probability that you develop CTE. I was wondering if you have any thoughts about whether or not we might get to the point that, we could actually predict this for someone, like by thinking about like how many concussions they've had, the first age that they had their concussion at. Could you put together some sort of like model to tell this person, look, you've got to the point where you got to stop playing football or you're going to get CTE? I mean, do you think we'll ever get there?
I think we have a long ways to go, but I think so. So there's a lot of research being done now on blood tests that can be done after sustaining a head injury. So these biomarkers that show that or demonstrate that there's inflammation going on within the brain. And once we have that as a tool and can track more accurately, like specifically definitively had a brain injury and this was the level of whatever enzyme or protein that was or biomarker that was being followed. I think so once we have more of these biomarkers that can be used for like blood tests, then we have more definitive numbers that can be followed and sort of correlated, and I think we will get there, but I think everything with the CTE is still it's certainly not new. There's still a lot to be learned. Like as probably a lot of people know, it really only is definitively diagnosed after someone's deceased and you actually dissect their brain. So there's also imaging techniques that are being done now, being tested now to potentially be able to screen for CTE prior to for someone having to have to be deceased and dissect their brain. MRI scans are not that good at it right now. Can't really tell. There's some research being done in PET, positron electron trans something. That's usually done for like cancer. It's usually like a screening for cancer in parts of the body. So they're trying to use that to see if that can show anything in the brain that might be changing in someone who's developing CTE. So yes, I think we'll get there. I think we've got a ways to go.
You've talked about terms like concussion, CTE, and TBI, and Jock in particular uses TBI for concussions. Can you differentiate those? Or maybe the doctor, what's the difference between concussion, a TBI, and CTE clinically?
So a concussion, so there's mild TBI and severe TBI. There's no moderate TBI. Mild TBI is a concussion. It is a mild traumatic brain injury. A mild TBI will not show any changes on imaging done, like a CT scan, anything on the kind of the macro scale. There will be no changes, but there will be symptoms. There will be a recovery period. There is injury on a more cellular level that you cannot see. That is a mild TBI. Severe TBI is when you actually have something on the macro level that will show up on a CT scan or something like that, where you have a brain bleed or you have like a shift of the brain or something like that. So really there's mild TBI, which is a concussion, severe TBI, which is more along the lines of what I just... So mild TBI, more on a cellular level, something you can't see, no structural changes. Severe TBI, structural changes, something you can see on a larger scale, bleeding, shifting of the mass of the brain, that sort of stuff.
And differentiate that from CTE then.
Changes that happen more chronically. So in the acute phase, you have this injury to the neurons and the cells in the brain, and their metabolism is thrown off, and they have a hard time sort of dealing with the everyday activities of daily living that you do, but they do heal. Whereas if that continues to happen on a larger scale, you start to have this degeneration of some of the tissues, leading to these tau proteins, I believe is what the plaques that build up on a more chronic time frame.
Why is that not measurable?
It doesn't get picked up on an MRI at this time. So so many football players are donating their brains to science. That's been a big thing because it does take the dissection post-mortem to see the cumulative effect of all these injuries over time. And a lot of them do have these plaques that are very similar to what you might see in an 80-something-year-old Alzheimer's patient, in 20-year-old, very otherwise healthy young people. So it is very scary, the degenerative aspect of some of these brain injuries, of what they're doing to these kids.
I just wanted to mention something regarding CTE, and that is the person I rely on most. They would say, well, that's chronic, and that's something that has happened more than once, whereas traumatic brain injury could be the first time, could be the only time. But if the person had a traumatic brain injury several times over the course of 3 or 4 years, then it would probably be considered chronic traumatic encephalopathy. That's the only way I can explain it. And yet, we know that the TBI can happen more than once, and so that would be chronic, I believe. What they need to do, and I believe this with all my heart, is that they need to get together so that everyone is on the exact same page, so that when they say CTE, that everyone is explaining it the same way.
All right, well, please join me in thanking our panel.
Thank you.